and I'm the Toxics Program Manager. And we're very excited to have to present tonight's webinar entitled Outdoor Air Toxics, the Latest Research and Fracking's Impacts on Community Health. And so tonight we're going to be talking about outdoor air toxics and some of the new science. And unfortunately, very few health professionals have been trained to help patients understand how to protect themselves from environmental toxics like outdoor air pollutants. And so in order to decrease risk and prevent the development of environmentally related diseases like asthma or learning disabilities, we really feel that healthcare providers must be trained in environmental health. And unfortunately, very few are. So PSR is seeking to help fill this void by offering Train the Trainer webinars given by experts in the field of environmental health. And we're really trying to do kind of a two-step process. First, train the trainer, and then train the new practitioner. And our goal is to train an adequate number of health professionals so you can then begin offering these presentations to area residency, nursing programs, or community clinics. And we're hoping that this second level of training will convey important skills, and which will then allow you to offer preventative environmental health guidance to your patients. And also, we hope, pique your interest in becoming policy advocates. And tonight's webinar is the third in our series of Train the Trainers. And so in terms of tonight's agenda, we will first be talking about the Clean Air Act and air toxics in general, and I'm going to be doing the presentation for that. I'm going to provide a brief overview of what the Clean Air Act regulates, kind of discuss sources of air pollution, highlight several air toxics, including particulate matter, ozone, and diesel exhaust, talk about some of their health impacts and ways to reduce exposure. And then following my presentation, we will have Dr. Larysa Dyrszka, who will then highlight fracking as a case study and depict why health professionals should be concerned about natural gas drilling in their communities. And so before I start my formal presentation, I'm just going to tell you a little bit about Dr. Dyrszka so we can kind of just go into her presentation after I finish mine. So Dr. Larysa Dyrszka is a board-certified pediatrician, and she's a former director of pediatrics at Holy Name Hospital. She's a graduate of Washington University School of Medicine in St. Louis, and following her residency and board certification in pediatrics, Dr. Dyrszka practiced general pediatrics and held the position of director of pediatrics at Holy Name Hospital in New Jersey. Her recent work has been focused on children's rights with the Conference of NGOs at the United Nations Committee on Children's Rights. She has been a State University of New York Sullivan Community College Board of Trustee member since 2009. And Dr. Dyrszka is an advocate for health on the issue of natural gas exploration and production. She's a founding member of the Sullivan Area Citizens for Responsible Energy Development, and she's also on the board of PSR New York. And together with fellow New York medical colleagues, she founded the Concerned Health Professionals of New York. And so in terms of housekeeping, before I start my presentation, we will be taking questions after Dr. Dyrszka's presentation. So if you have a question, you can just feel free to type it into the question box on the GoToWebinar control panel, and I will go ahead and read those out as we get them in. So let me start my presentation. So as I said, I'm just going to briefly talk about, provide a basic overview of the Clean Air Act, talk a little bit about the different sources of pollution, and specifically talk about some of the criteria pollutants designated under the Clean Air Act, and then offer some brief ways that patients, the public, can reduce their risk exposure. And so this first slide kind of just goes over a little bit about what's in our outdoor air. And as you can see, there's a lot of different ingredients, I guess you could say. You could say it's kind of a chemical soup. And so when it comes to the Clean Air Act, the Clean Air Act, Congress really designed it to combat a variety of air pollution problems. And it was originally passed in 1973 and amended in 1990. And it requires EPA to establish national ambient air quality standards for certain common and widespread pollutants based on the latest science. And so it identifies two types of national ambient air quality standards. You first have a primary standard, which provides public health protection, and it includes protecting the health of what we would call sensitive populations, such as children and the elderly. And then there's also secondary standards, and those provide public welfare protection, including protections against decreased visibility and damage to animals, crops, vegetation. And so under the Clean Air Act, EPA has set air quality standards for 6 common criteria pollutants, which is, you can see those on the slide. They include particulate matter, ozone, sulfur dioxide, carbon monoxide, and lead. And these criteria pollutants really have two kind of defining characteristics. They both endanger public health, and they are also widely present in the outside air, usually affecting most of the U.S. They're also often emitted by multiple sources and sources that are commonly found, such as cars, diesel vehicles, coal-fired power plants, and industrial facilities. And then, so in addition to settling out of the air to form kind of hot spots in the immediate vicinity around their source, these criteria pollutants often disperse widely. And so for these reasons, effective regulation of these types of pollutants is not done on a source-by-source basis, but instead is done by monitoring their level in the atmosphere in every state and ensuring that they remain at non-harmful levels. And so in order to do that, states are required to adopt plans, or what are called state implementation plans, to maintain air quality, meeting the national air quality standards. So beyond these criteria pollutants, the Clean Air Act also contains provisions to address what are called hazardous or toxic air pollutants. And these pollutants pose health risks such as cancer or environmental threats. And under the Clean Air Act, EPA is required to address 188 of these toxic air pollutants. And some examples, as you can see, include benzene, which is found in gasoline, perchloroethylene, which is found in some dry cleaning facilities, certain metals. And so within those original 188, there are actually 33 are included in a priority list that are special concern because of their widespread use and for their potential to cause cancer or also harm the fetus. And so the last kind of just touch on briefly is the greenhouse gases. And as most of you probably already know, under the Clean Air Act, under the recently passed Clean Power Plan, EPA now regulates CO2 from power plants. And along with that, an even more recent regulation was passed related to methane emissions from the oil and gas industry from new sources. And so in terms of what are some of the, so this slide talks about some of the accomplishments of the Clean Air Act. And as you can see, the slide shows that the aggregate emissions of the 6 criteria pollutants that I was talking about on the previous slide has dropped 69% between 1970 and 2014. And so, you know, the Clean Air Act has a 40-year track record of cutting dangerous pollution and has also prevented more than 400,000 premature deaths. And so, as you can see, it's done. You know, we've made progress since passage. And some other kind of key stats in terms of ground level ozone, that's also been cut by more than 25% since 1990. So then I'm then going to talk, this slide talks a little bit about the different sources of air pollution. And the Clean Air Act allows the EPA, working with the states, to place limits on pollution from many sources of air pollution. EPA can develop national regulations for mobile and stationary sources, which must be met by industry and the source operators. So when it comes to mobile source pollution, they usually enforce those by regulate those by enforcing emission standards for newly built or rebuilt engines. And when we say mobile sources, that can be off-road vehicles, that could be equipment, usually propelled by internal combustion engines, school buses, etc. And when it comes to stationary sources, the states and the EPA ensures that these sources do not emit more pollution than allowed by regulations through permitting programs. So stationary sources, you use permits. The EPA uses permits. And then under the major sources, that's often what would be considered, major sources are considered things that are producing large amounts of emissions, for example, the ports. And in the 1990 Clean Air Act amendments, these major sources are required to meet certain technology-based standards. And that's how these major sources are regulated. Now, I'm going to talk a little specifically about certain criteria pollutants, and the first one is particulate matter and some of the health impacts and routes of exposures for particulate matter. And so when it comes to particulate matter, this slide really shows you how the size of a particle is directly linked to their potential for causing health problems. And so the EPA is concerned about particles that are 10 micrometers in diameter or smaller, because those are the particles that generally pass through the throat and nose and can enter the lungs. And so once these are inhaled, these particles can affect the heart and lungs and cause serious health effects. And so EPA groups this particle pollution into two categories. You have the inhalable coarse particles, which are often those found near roadways, and then and are larger than the 2.5 micrometers and smaller than 10 micrometers in diameter. And then you have the fine particles, which are those found in smoke and haze, and are 2.5 micrometers in diameter and smaller. And these particles can be directly emitted from sources such as forest fires, or they can form when gases are emitted from power plants or automobiles. And so when it comes to sources, like I was saying, these particulate matter pollutants can be found in cars or power plants. They can also include tiny particles of black carbon, organic carbon, certain metals. And then when you're talking about health concerns, these particles can, like I said before, enter through the lung. They may also pass the blood-brain or placental barriers, and then they can flow easily within the body once they do that into organs and tissues due to their size. And then when it comes to new research, there was a study just came out in March that showed that a new study related to particulate matter exposure in preterm births, and it estimated that in the U.S. That particulate air pollution was linked to nearly 16,000 preterm births per year. And when we talk about what EPA has done under the Clean Air Act for particulate matter and regulation, so for the first time in 15 years, EPA actually strengthened the national standards for particulate pollution in 2012. And that was kind of after a long, protracted battle, legal battle, which public health groups eventually won to get those stronger standards. And so what I then wanted to talk just briefly about was the ozone and ground level ozone. And ground level ozone is the primary constituent of smog. It's often difficult to control, and it's very pervasive. And unlike other pollutants, ozone is not emitted directly into the air by a specific source. It's created by sunlight acting on nitrogen oxides and VOC in the air. And so, there are thousands of types of sources of these gases. Common sources include gasoline vapors, chemical solvents, combustion products of fuels, and certain other consumer products. And so these emissions, ozone emissions, can be carried hundreds of miles and result in high ozone concentrations over very large regions. And this ground level ozone can cause a wide range of health impacts, including asthma, permanent lung damage, and also can affect fetal development. And I guess the one other thing I would want to say about ozone is that a lot of the burden is not even evenly distributed, and often poor communities and communities of color bear a disproportionate share of the health burden when it comes to specifically air pollution in general, but ozone specifically. And so when it comes to recent research, there's been recent studies that consistently report associations between short-term ozone exposure and total non-accidental mortality, which includes deaths from respiratory causes. And so under the Clean Air Act and ozone regulation, the EPA just last year updated their ozone standards to a new standard of 70 parts per billion, which a lot of health groups and environmental groups weren't too thrilled with. A lot of the groups wanted a stronger standard of 60 parts per billion, but the EPA came out with a 70 parts per billion. And so just to interpret, how do you interpret the graph on the slide here? Essentially, the blue band shows the distribution of air pollution levels among the trend sites, displaying the middle 80%, and then the white line represents the average among all the trend sites. Here it says that 90% of the sites have concentrations below the top line, while 10% have concentrations below the bottom line. And then kind of the final air toxic I wanted to talk about were the polycyclic aromatic hydrocarbons. And this is a very large group of over 100 different chemicals that are formed during the incomplete burning of coal, oil, and gas, or other substances like tobacco or even charbroiled meat. And these PHHs are usually found as a mixture containing 2 or more of these compounds, such as soot. And the PAHs enter the air mostly as releases from forest fires, burning coal, or car exhaust. And they also can attach in the air to dust particles. And then these PHHs then break down in the sunlight with sunlight and other chemicals in the air, and they can break down over a period of days or weeks. And when it comes to exposure routes, breathing air containing PAHs in the workplace of coal tar or asphalt production plants is a common exposure. Cigarette smoke, wood smoke, vehicle exhausts are also another route of exposure. And then also eating grilled or charred meats too, you can be exposed to the PAHs. And so I did want to point out that most of them are lipophilic, so they can be stored in fatty tissue of the body, such as breasts. And some of the newer research has shown them as a possible linkage to breast cancer. And then when it comes to the more than 100 forms of the different types of PHs, you have actually 15 that are listed as reasonably anticipated to be a human carcinogen. as reported by the National Toxicology Program. And so one other air pollutant I wanted to touch on just very, very briefly is the diesel particulate matter. And as most of you probably know, diesel particulate is a complex mixture of a lot of different chemicals that eventually makes up diesel exhaust. And diesel exhaust, is emitted from a broad range of diesel engines, on-road engines of trucks, buses, and also off-road diesel engines, including trains, marine vessels, or other heavy-duty equipment. And so the most common exposure pathway is breathing the air that contains diesel particulate matter. And the fine and ultrafine particles that make up diesel exhaust can avoid many of the respiratory system's defense mechanisms, and therefore are able to enter pretty deeply into the lung. And so when it comes to health impacts, acute exposure may cause irritation to the eyes, nose, throats, or lungs. Lightheadedness has also been found as a impact. And then when it comes to studies, there is considerable evidence that diesel exhaust is a likely carcinogen. And some of the newer research is also suggesting that diesel exhaust could be implicated in the development of cancer of the bladder in humans. But that's kind of newer research that looks like further has to be looked at. Further studies have to be done to make a stronger link. And so I wanted to just kind of end by giving a few recommendations that might reduce exposure to some of the both outdoor air pollutants. Removing your shoes when you're inside the house is always a good mechanism for lowering pollutants in your home. Following the air quality index, and you can do that at the airnow.gov, is also a good idea. Using a portable air purifier, so you do have to kind of do your research when it comes to what type of air purifier you're getting. I know there's a lot on the market there. And then, avoiding idling your car or being around diesel engines that are idling, and then trying to minimize consumption of charbroiled or char-grilled or smoked meats and fish, and that has to do with the PAHs. And then finally, of course, make a plug for following legislation, both the state, national, or local level on air toxics, and kind of being aware what's on the calendar when it comes to advocacy is always important too. And so that's what I have for the outdoor air toxic portion. And so let me turn it over to Dr. Dyrszka. And like I said, we will be taking questions at the end of the Dr. Dyrszka's presentation. Okay, thank you.
Thanks, Kathy. What you've said has underscored how much we already know, but as far as the gas drilling, how far we have yet to come. The discussion about health and environmental impacts of shale gas extraction and production could fill a book. So I say that we still have so far to go as far as establishing pathways of exposure, but there's an awful lot of information that we know. In fact, it's filled several books, including a PSR and Concerned Health Professionals of New York, our own compendium. It's in its 3rd edition now. One of these compilations was available as far back or as recently as 3 years ago. So I'd like to spend a little bit of time explaining the health impacts of shale gas. I've briefly gone over these in a previous webinar for PSR that was on infrastructure. But this is I'm going to include all aspects of oil and gas exploration, production, and even end use. The body of science evaluating the potential impacts of unconventional gas development has grown, and you can see from this graph the authors Jake Hayes and Seth Shonkoff provide an overview of the peer-reviewed scientific literature from when it first appeared, which was in 2009, to 2015, as it relates to the potential impacts of gas development on public health, water quality, and air quality. So I will be speaking about not just air quality, but also potential contaminants via the waterborne route. The results here indicate, if you look at the actual reference and delve a little bit more into it, you'll see that there are 685 papers now published in the peer-reviewed literature relevant to the impacts, and 84% of the public health studies contain findings that indicate public health hazards, risks, or adverse health outcomes. And 69% of the water quality studies contain findings indicative of potential or actual incidents of water contamination, and as a very large number, 87% of air quality studies indicate elevated air pollutant emissions or atmospheric concentrations. So it should help lay the foundation, the empirical foundation for policy decisions, and start being a source for specific exposure. Gas is being extracted in over 30 states, so the potential impact will be major. And you know, we're not just thinking about the Marcellus Shale here. We're thinking about areas where gas is not just extracted but also used. Now, for example, you don't see here states like Wisconsin where the silica is being extracted, and there are going to be impacts there, and also at end use. So let me go on to some of the impacts. To establish the pathways of exposure, you need to identify site-specific exposure situations, and you have to answer questions like, is anyone at a given site exposed to environmental contamination, and under what conditions would this exposure be occurring? So I'm going to try to identify some of the sites where exposure might occur, show you how that information is being collected to determine who's being impacted, and then under what conditions. So very briefly, the high-volume slick water horizontal fracking is labor-intensive, resource-intensive, money-intensive compared to the old type. It's been shown that environmental problems have been encountered and adverse health impacts have been observed during all of the steps. For example, during the mining of silica sand, water can be contaminated with chemicals. This is during fracking or during injection of waste, during waste disposal. During transport, there can be spills of chemicals and traffic accidents, which could cause a variety of problems. During the drilling, the aquifers can become contaminated with methane and chemicals because of casing failure, and there could be exposure to radionuclides, which are carcinogenic during several of the steps: extraction, processing, transport. Air pollution with ozone production from the transport vehicles, and then during drilling, venting, flaring, and processing, and also at the infrastructure like compressor stations. And then there are emissions of the criteria air pollutants like oxides, sulfur dioxide, volatile organic compounds, formaldehyde, and particulate matter. And then there's the waste disposal problem. So large quantities of silica are used, and in addition to being an occupational lung carcinogen, inhaling the silica dust causes chronic obstructive pulmonary disease, renal failure, various autoimmune diseases, and individuals with silicosis are at a higher risk of tuberculosis. Some of the chemicals used in gas drilling and hydraulic fracturing that are toxic to human health include this list in the bottom half of the slide. And the problem is that it's still considered proprietary in many cases, but what we do know, largely through the work of people, pioneers like Dr. Theo Colburn, they're suspected carcinogens, mutagens, endocrine disruptors, which she tagged neurotoxins, and hazardous air pollutants. And they have affected, many of these products have effects at low doses, especially the endocrine disruptors, and pregnant women shouldn't be exposed at all to many of these. This slide shows the potential gas and fluid movement pathways. The figure on the right is from New York City's 2009 Hazen and Sawyer report, which they submitted to on the draft SGIS, and it shows how connections can be made from formation layers to aquifers, underground structures, and the surface. There are natural and artificially induced fractures that can act as conduits. There are abandoned wells that do the same. Spills from above can contaminate water. And importantly, casing lining those gray areas lining the gas well at the top in the vertical part is thin. It's man-made, sometimes flawed when it's built, built first, and doesn't last forever. 6 to 9% of casings will immediately fail, and there's a 50% failure rate by 15 years, and in 50 years they all fail. Unconventional oil and gas operations can contribute, or rather they can contaminate both surface and groundwater during the transport, injection of fluids, the well casing failures. They unfortunately contain radium, heavy metals, BTEX, and other compounds that are hard to get rid of. In the shale are naturally occurring volatile organic hydrocarbons such as benzene, ethylene, toluene, and xylene, and radionuclides, which cause cancer, reproductive problems, and neurological issues. Shales, because they're formed from an ancient sea more than any other kind of rock, trap heavy metals like lead, arsenic, barium, strontium, and chromium. And when the shale is fracked, these heavy metals are released and brought to the surface with the gas. The waste disposal method right now is through underground injection wells, which can cause earthquakes, spread on soil farms, spread on roads as de-icers and dust control, and sent out into streams or rivers from wastewater treatment plants, which just are not made to handle this waste. On this list are the components of natural gas in the gas fields, or I should say shale gas, but industry calls it natural gas, and that's what most people are familiar with, though we prefer to use unconventional gas or shale gas. The sources are emissions and waste from transport vehicles, combustion at compressor stations, storage and condensate tanks, metering stations, processing plants, pipelines, so from flaring, venting, and leaks accounts for a large amount of greenhouse gas production. And the infrastructure includes compressor engines and blowdowns, condensate and storage tanks, racks, dehydrating units, amine unit separators, and fugitive emissions. There are many individuals living nearby who, actually 90% of individuals who report odor events from the facilities live within about 2 miles of this. The exposure is cumulative and costly to taxpayers. Kathy covered most of the associated health impacts, so I won't go into the details of that, but just to underscore that they are toxic to, especially to children, and new research is continually coming out, especially of particulate matter, and also as to the carcinogenicity of both particulate matter, formaldehyde, and some of the other hazardous air pollutants. This is to give you an idea of the massive network of pipelines. The top right slide shows you the oil and gas pipelines. Accidents can occur at any point of gas production, from the transport of the materials to the site to construction of and operation of the facility and the processing, and then the delivery via these pipelines. And wherever there's an accidental release, people are subjected to air toxins. The oil and gas industry is trying to extract as much fossil fuel as they can. To succeed, they need ways to transport. So besides pipelines, if it doesn't fit a pipeline, they might consider crude oil by rail transport, and that's to the left, the photo, the graph. And the bottom right picture is a representation of an LNG tanker. That orange structure is one big ship pulling out of a harbor. And PSR has written a paper about the security risks of LNG terminals. Their existence will also increase unconventional gas development and be a risk for accidents and spills. The areas overlying the Marcellus Shale have high indoor radium and therefore radon on average already, and those are the areas that are shown in red on the top right-hand side. It's a piece of an EPA map, and those radioactive elements include uranium, thorium, radium, polonium, and radon. Which radon being the leading cause of lung cancer among non-smokers. The radionuclides, lead-210 and polonium-210, the decay products of radon can be found in pipeline scrapings, as well as the sludge accumulating in tank bottoms, in the gas and oil separators, dehydration vessels, LNG storage tanks, and in waste pits. And it's confirmed in a description from a 2008 publication of the International Association of Oil and Gas Producers industry paper, which is on the lower left, and it shows you how NORM can accumulate. Radon will travel with methane through the pipelines, and depending on the travel time can present in the home with the methane, and then it can be inhaled. Several studies have shown that children are more susceptible to radon exposure than adults, having different lung architecture and breathing patterns, resulting in a larger dose of radiation to the respiratory tract. They have longer latency periods in which to develop cancer, and on average children 70% more time in the house than adults do. So for these reasons, radon exposure for vulnerable populations like children and pregnant women is especially risky. Pipeline inspection or intervention, gizmos, gadgets, gauges, inspect and clean out the pipes. Those usually are fitted or are sent through the pipeline to clean it out or to inspect it. And the material that you see with the red, at the red pigging station, top right, and the material, that black material in the bottom left, is a repository of toxins, including radon decay products, polonium and lead, which are solid. There's pipe film, there's black powder, bacteria, scale and sludge that is cleaned out and must be disposed of, to which residents can be exposed to, and of course workers. So having set this bit of a background on oil and gas operations, I'm going to address some of the health impacts that have been observed and the concerns, and then get into some of the potential routes of exposure. The major stressors that I've just identified, or hopefully have identified in areas where the shale gas is extracted and processed include air pollution, water contamination, the chemical mix, radioactivity, waste disposal, and of course, Kathy touched on climate change. This slide summarizes some of a group's experiences, a group in Southwest Pennsylvania. It's the Environmental Health Project, and it's the first clinic that has operated consistently now for several years, addressing concerns of residents living near gas drilling operations. They set out to identify potential pathways for contamination, and but basically their concern was to listen to the residents' complaints. And then as part of their history, they asked about potential likely chemicals to which those individuals might have been exposed. In looking at the possibility of toxins and a review of the literature of air exposures led the toxicologists to produce a list of compounds that have potent physiological impacts and are found in high concentrations in various phases of the extraction process. So these are the classes of the pollutants based on their research and experience and speaking to the clients. The classes of pollutants that are to impact human health through the air pathway include the volatile organic compounds, polycyclic aromatic hydrocarbons, and the BTEX chemicals. In the short term, these chemicals can cause symptoms which I'll describe going forward in the next slides. And many of these, unfortunately, are known carcinogens or have long-term health impacts. Dr. Brown also describes necessary criteria for designating a symptom as attributable to gas extraction activities, and that includes a temporal relationship, meaning the development of the symptom or an exacerbation of a pre-existing symptom after the onset of the gas extraction activities. A plausible exposure, which means an identifiable exposure source in proximity to the individual experiencing symptoms, and an absence of an explanation, meaning that symptoms were not attributed to gas extraction activities. This is in their analysis. If an individual had an underlying medical condition that was as likely or more likely to have caused the symptom. So this box in red is really a very important one as far as the criteria for attributing symptoms to gas extraction activities. Another group of researchers made these observations in another recent National Academy of Sciences workshop. They identified major stressors, which are the air emissions, ground and surface water contamination, truck traffic, noise, accidents, malfunctions. So you'll see that those initial problems that I described, together with subsequent studies, develop a common thread here. So what were some of the complaints? First, let me just point out that these photos are thermal emissions with a special infrared camera called a FLIR, F-L-I-R, which can't be seen with the naked eye. And although the residents living nearby didn't have access to these cameras, they were feeling the impacts, and these were the most common complaints, some of which I've been able to personally collect in visits to Southwest Pennsylvania, West Virginia, and also at a relatively small compressor station in New York State. The long-term consequences take years to develop because of latency, but we know what some of the chemicals are that are being observed and even recorded and measured in gas fields. So we know that we will be expecting to see increases in cardiovascular problems and such respiratory problems as exacerbations of asthma and chronic obstructive pulmonary disease, neurological problems, and probably cognitive deficits in children. There's a lot of research on polycyclic aromatic hydrocarbons, and then birth defects, cancer, and premature mortality. Colleagues have published also some series of cases in a peer-reviewed journal, Bamberger and Oswald as an example, and in one of their case descriptions, a child became ill with fatigue, confusion, abdominal and back pain, and after several animals in the household had died, the doctor tested for toxins which revealed arsenic in the child's blood. The family then stopped drinking the well water and he eventually recovered, though he lost a year of school. There were, in addition, there were 25 gas wells within 2 miles of the home. There was an aerated impound and 2 compressor stations, so it's hard to know what the insult was, but where the arsenic originated, other than the fact that it was in the well water, but what was the contaminant is what we don't know. But one of the problems is that regulations can hamper information. So for example, in some states, private water wells are not regulated by the Safe Drinking Water Act and not routinely tested for chemicals like arsenic. So if it hadn't been for the deaths of the animals, the human health effects wouldn't have been diagnosed in this child. And there are other cases that they describe, and they fit the criteria of having been impacted by an industrial or environmental toxin nearby. That temporal relationship that Dr. Brown mentions, a plausible exposure, and absence of a more likely explanation. And having spent time with these impacted people, I'm also convinced that the health of many of them living near the gas wells, processing plants, and compressors is deteriorating, and that it's the result of the gas drilling activities. They were well before, they're not now, and there's no other plausible reason for their illnesses. And given that exposures and illness increase over time, and given that many instances of contamination and illness related to these toxins never come to light because of non-disclosure agreements, I have concerns about the potential for a large number of people being impacted before we get to the point of developing pathways, documenting pathways of exposure. At Southwest Pennsylvania's Environmental Health Project's clinic, the clinicians were observing symptoms in people living near gas development, and those symptoms could be persistent or transient, sometimes intermittent, and these variations in symptom presentation were consistent with the changing and episodic nature of exposures. The graph is a screenshot of a SPEC particulate matter monitor 12-hour report, and one would expect that the symptom severity would correlate with the height of the particulate matter measurement, and it did. Southwest Pennsylvania Environmental Health Project reviewed data that they had previously collected and used particulate matter as a marker for all the emissions from and used SPEC monitors for the particulate matter, assessed the symptoms against particulate matter peaks, and found a linear correlation between symptoms and particulate matter peaks. So the residents of mini sink, which is in New York State, where gas drilling is banned, but compressor stations and other infrastructure is coming online very quickly, and people were becoming ill, and yet their environmental assessments from FERC were saying that nobody should be getting ill, yet that people were. So they called on Environmental Health Project to study their community, and they note that measurements, or it was noted that the measurements are done by the company, and it was on a sampling basis and not continuous, so a lot of these impacts were not correlating with their low air quality indices and any monitoring reports that were available. So the Environmental Health Project proposed to use the community's participation. A health professional would do the individual health assessments, and there would be continuous monitoring for particulate matter. And 8 families were studied. Individual health assessments were done on each individual in those 8 families, and that included 12 in children. To summarize, the predominant health impacts reported were respiratory problems in 22, neurological problems in 12, and dermatological problems in 10. And then there was the SF-36, which is a standardized self-assessment, overall mental health and well-being level survey, and those were below normal for half of the respondents. Environmental Health Project concluded that families living near the mini-sink compressor station are both exposed to elevated levels of particulate matter 2.5 compared to the regional air quality index, and that the health symptoms are most likely associated with the episodic high emissions that come from the compressor station. And this is the spec monitor documenting some of those exceptionally high spikes that would not have been captured if averaged over the 24-hour period that air quality indices are determined by. The yellow line is the level at which sensitive individuals could be affected. And this is that data presented in graph form showing the episodic high levels. So those peaks, recorded peak levels from the spec monitors, would not have been detected, or were not same days that the air quality indices were very low, like 9 and 5 and 10. The spec monitor was reading in the hundreds, so there was a real disconnect there. And as a pediatrician, I just need to point out that children are especially vulnerable to all sorts of toxins with air pollutants because their lungs are developing and growing. But also same with radioactive materials and with waterborne toxins. There's a really good 2014 paper in Reviews on Environmental Health on the developmental and reproductive effects of chemicals associated with unconventional oil and gas operations, and the authors, Webb and Nagel and others, elegantly begin to make the case for potential pathways of exposure. In this list, in this table, there's a list of common chemicals, exposure routes, and the toxic endpoint. So I just want to demonstrate that this has been now compiled into a list. The chemical is listed, the exposure route, the limit of exposure, and the potential for the toxic endpoint. So the research is beginning to consolidate some of this evidence, and I'm pleased to say that I share the enthusiasm on this data. So as I showed you in my early slides on gas exploration and production, the possible mechanism of action, for example, on water contamination, could occur from spills, from injection, storage, well casing failure, and the mechanism of water possible mechanism of action producing water contamination can then be either then through oral or inhalational if you're taking a shower, for example. Dermal route is another one that should probably be considered, but there's probably not enough evidence at this point to add that to the list. But I have found that dermal routes have been a complaint among some of the residents. And air emissions around drill sites and compressor stations have been reported to have elevated concentrations of chemicals like formaldehyde, hydrogen sulfide, hexane, particulate matter, BTEX, and chemicals and other volatile organic compounds. So the residents are reporting the health symptoms, but we haven't yet established those pathways of exposure. It should be pretty well, some of these steps have already been done, and I think that we're getting pretty close to determining the pathway of exposure. And because what we know already, we know the points of exposure, we know concentrations of environmental contamination at some of these points, and the populations that are potentially exposed. So where are we with regard to identifying routes of exposure, and why don't we know more? Still, the literature is new. It hasn't been incorporated into the regulatory process. The federal exemptions from the 2005 Energy Policy Act and other exemptions limit the information. The information, doctors aren't normally trained. As Kathy had suggested, we need to do a better job in training physicians, nurses, health practitioners that see these patients and public health people to recognize these particular environmental exposures. So they may be trained in toxicology, but there's a need to also know about oil and gas operations. And non-disclosure agreements have prevented access to health information. So we know that, just to conclude, that people are exposed. We know that they have symptoms. We know what some of the contaminants are. There's overwhelming evidence to say that there is harm to human health. I believe that pathways of exposure will soon be identified, although many comprehensive studies, which include risk assessments, are lacking. There are some, and there are going to be many more that demonstrate the negative health impacts. But in the meantime, that overwhelming evidence exists to follow the precautionary principle. Thank you, and Kathy, I guess we'll take questions now.
Yes, thank you, Larysa. This is Kathy Attar again, and so if you do have a question, just feel free to type it into the question box on the control panel, and I'll go ahead and read the questions once they're typed in. Okay. Okay, I don't see any questions so far. Does anyone have any questions? I know it's a little bit past 8, but we were scheduled to go till about 8:30, so we do have a few minutes for questions if anyone has any.
Kathy, I think I see some in the questions box.
Okay, see, my question, I'm sorry, Julie, can you read them off, because they're not coming up on mine. Oh, okay, here we go. So just the first one, so just to get off the logistical question, so the slides are going to be available both on our website after the presentation for future use. And then Larysa, there's a question regarding other than containing methane, are there regulatory actions for other fracking pollutants?
Well, it depends on the state. If you're looking at the actual gas wells, so gas wells are pretty much all, well, mostly, except for federal lands. That's something else. But those that would be occurring on private and state lands would be subject to state regulations, and they differ like, night and day.
Okay. There's also a question regarding, Trish O'Day had a question about whether there are any simple actions that low-income people can take to avoid poor air quality. Do you have any suggestions, Larysa?
That really is it's a sad situation that we're in, because very often this fracking activity is occurring in areas where people are poor, in rural areas. In Los Angeles, I visited some of the gas wells and sites where they're separating some of these chemicals, and they're in the poor Hispanic population areas in Los Angeles, but in the poor areas. So what can you do about, you can advocate that. You have to bring it to the attention of the government and advocate for these people, and there are environmental justice presidential executive orders that President Clinton produced on behalf of people who are, who are environmental justice community and vulnerable populations like children. But there's always a way that industry they always find a way to get around it. They say they've done their due diligence and nobody will be impacted. You hear it time and time again. It's really hard. And I feel really, really badly that we can't do or aren't doing more for the environmental justice community.
Okay. We have another question. Leslie Cortez wanted to know if we know anything about the health hazards of coal rollers.
No, sorry.
I don't
Is that
either.
an R-O? I don't even know if that's an R-O-L-L-E-R or what.
Yeah, it's spelled, like a roller coaster, but
yeah,
the first roller. We can get you. We can look up some information on that question. Then another question from a Jade Heverly Campbell. She wants to know have you come across any evidence indicating that these chemicals could contribute to mental health issues?
Yes. Yes. Personal experience speaking with people who live in these gas fields, besides irritability and anxiety and a feeling of loss and abandonment and depression, some have actually needed to go on medication for more serious anxiety and depression. And then other people that I know, the family, their children had movement disorders and attention deficit hyperactivity disorder. Now, that's not to say we know basically what chemicals were being emitted in this area where these people were living, but to actually make that connection that these kids and this family, that exposure led to these psychiatric problems and neurological problems, that hasn't been proven yet. That's where that potential for exposure exists, but to say that these particular people were exposed, we don't have that information for that particular family. But we do have evidence, scientific studies that show, for example, Frederica Pereira has done a lot of studies on polycyclic aromatic hydrocarbon exposure and developmental problems in children. Several studies on autism now and exposure to PAHs. And particulate matter also seems to be causing some neurodevelopmental problems. So yeah, there is evidence that these chemicals are causing problems in from the fetus all the way to the adult.
Then Brandy Joyner had a question. She wanted to know if you have any advice for the school health population in order to help monitor and control exacerbations. So she wanted to know more about the, schools and what they could possibly do in terms of monitoring.
Really good question, and that's where some of that education that you're talking about, Kathy, getting that group of school nurses educated so that they could be on the lookout in areas where either fracking is occurring or lots of compressor stations are located, so that they could be on the lookout for ADHD, for children failing in school, for aggressive behavior. Those are all potential problems, but they don't. There's no education process in place right now that I know of that would cause the school nurses to be on the lookout for these things.
Right. Yep. And then a couple of folks wanted to know a little bit about kind of some of your personal advocacy experience. They wanted to know if you share this info or your information with public health communities, the media, or policymakers. So maybe you want to just talk a little bit about some of your experiences there, Larysa.
Well, thanks for being interested in that. But this has been a kind of well, first of all, let me just say that my colleagues and I, who are working in New York, most of my colleagues are in New York. Some of them are now in Pennsylvania and in Connecticut. We're all volunteers. So this started as a set of comments on the New York's Supplemental Generic Environmental Impact Statement. And what we found was there was a lack of any reference to health. And so we started asking for the health impact assessment. It's a process that brings public health to the table. But I'm not a trained public health expert. I was basically speaking from my experience as a pediatrician and advocate for children. So I guess my experience at the United Nations might have helped a little bit with advocacy, because working with on children's rights, and yeah, so I think it was a myriad of different background experiences that allowed me to be in a position to then take this to our state Senate and Assembly. And I have to say they were very, very open to being educated. So it was an educational process at that level. I've also been speaking with people at hearings from our town board all the way up to the state level. Have not done any real federal advocacy except on the EPA water study. There have been several conference calls where people have been allowed to speak and submit comments, so I did participate in that. And then educating, basically educating our health professionals is kind of the next step that I'm seeing as a need. And what you're doing at PSR here right now is part of that process. So lately I've been working more with Physicians for Social Responsibility and continuing the the good work that you've all started.
Thank you, Larysa. I think that's very helpful, and as you say, I think PSR, one of our main priorities is to really try and get more health professionals on board when it comes to learning more about fracking, natural gas infrastructure, climate change, the oil and gas industry in general. And so really appreciate you speaking here today and last month's webinar as well. And so I think those were all the questions that folks had. So in closing, I just wanted to thank folks again for joining us this evening for our third Train the Trainer webinar. As I said just a little while ago, the webinar will be available on our website within a few days for future use and reference, as well as the slides. And so I wanted to thank Julia Morgan, our webmaster, for ensuring that there were no tech issues tonight. And I also wanted to let you know that I will be in touch with you, the folks on the webinar, regarding additional training opportunities, as well as potential advocacy activities that we might try to organize related to natural gas infrastructure and fracking, both in New York and in other areas. So thanks again, and have a good night.